Access to contraception has an enormous impact on an individual's ability to live the life that they want. Reproductive autonomy is a fundamental human right. And what we've seen in the research that we've done is that people who can get the methods that they want are better able to use them, tend to have fewer unintended pregnancies, and are able to get the education and pursue the careers that they want to have. The Ascent Center played a role in expanding access to contraceptive care in Utah through a number of different initiatives that we've been doing for the last several years. Some of them are looking at improving the strength of the health system to ensure that providers and clinics can better provide that care. And others have been aimed at improving access to all methods of contraception so that people at all levels of income can get what they want.
One research project that really shows our impact is the levonorgestrel IUD study. This study demonstrated that the hormonal IUD was effective for emergency contraception. We worked with our local Planned Parenthood affiliate. We conducted the study at 4 local sites. That research, which was published in the New England Journal, influenced care so that all Planned Parenthood sites nationwide deliver the levonorgestrel IUD. Now, we're collaborating with 8 Planned Parenthood sites nationwide to show reproducibility and generalizability of those findings.
The IUD study really allowed for us to build a research infrastructure and expand at Planned Parenthood Association clinics of Utah. And one of the things that we found is that patients were interested in the IUD study, but also still were interested in other forms of contraception. We saw that many participants were still interested in the hormonal implant, which is another form of long-acting contraception.
The work that I'm doing with adolescents right now is specifically looking at their use of Nexplanon or the implant. What we're seeing with our study and with our data is that many adolescents are using Nexplanon as their first method, which is unusual for long-acting methods of contraception, and means that a lot of adolescents are kind of changing their contraceptive desires and behaviors. So by following them over time and really understanding the decisions that they're making and the experiences they're having with these long-acting methods, we can better figure out how to counsel and serve this really unique population.
We've had the opportunity to be a site for a number of different studies, which has really helped to support and grow our infrastructure at the university to expand into other clinical trials and investigator-initiated studies. The CCTN really gives us the opportunity to meet with national collaborators on different protocols, and we have been a top recruiter for many of their clinical trials and had amazing retention rates of our patients because of the expert level research coordinators that we have on staff here.
So the Ascent Center has engaged with various levels of policy, including education and resources and research for our advocate partners as well as policymakers to really try and ensure policy around reproductive health in Utah is evidence-based and that folks have the research to support those policies. We have a lot of learners and students that are super interested in policy aspect, many that are really passionate about sexual and reproductive health as well. And so figuring out ways to channel that is something that we're doing at the Ascent Center, both through our Hinckley Institute internships, as well as our Summer Institute in Women's and Reproductive Health, which allows people to have some sort of research and policy exposure.
Family Planning Elevated is a statewide contraceptive initiative. We worked with different clinics in different areas of the state and trained their providers on how to give all methods of contraception. We worked with all of their teams to ensure that counseling was done in a correct way, and we offered low and no cost methods of contraception to people who fell in the existing coverage gap.
Project ECHO is a webinar series that is designed to bring some of the knowledge and expertise of experts in our institution to community providers throughout the state. I am a second-year complex family planning fellow. In my clinical role, I function as a general OBGYN, which encompasses all aspects of sexual and reproductive health. But specifically in the fellowship, I get extra training and mentorship in clinical care, research, advocacy, and policy as it relates to sexual and reproductive health, particularly related to contraception and abortion care. I've also had the opportunity to work with others in the Ascent Center team to do trainings for options counseling, contraception counseling for not only other clinicians throughout the state, but for pharmacists and other groups of people. So it's been a really rewarding experience.
Some of the novel methods that we've been able to explore at the university have really broadened our understanding of contraception and allowed participants to experience new methods, some of whom don't want to stop their method after the trial is over because they're so happy with the new product that will hopefully be brought to market at the end.
The bottom line for all of our research is it's got to improve patient care in the end. And we've been very selective about projects that we participate in because we're so focused on the ability of the findings to really drive care forward in the future.